Okay, we're ready to connect the TPN bag to the patient. So you need your TPN bag, your pump with a previously primed tubing, some alcohol wipes, and a saline syringe. First, we're going to remove the plastic from the saline syringe. There is a small air bubble in the syringe that we need to remove, so carefully remove the cap and set it upside down on the table without touching the ends. Pull back on your syringe just a little bit to break the seal and line that bubble up and push it out the top. You should see fluid come out the top. Carefully pick up your cap and recap. Okay, we need an alcohol wipe. Going to alcohol wipe the patient's injection cap for a full 15 seconds. The sides, but especially the top. Okay, you need to make sure this clamp is open, if there is one on the line, and you may need to get some extra help to hold the injection cap so you don't touch anything. Remove the cap, line up the two ends, and push while you twist. If the syringe pops off and you've touched any other surface, you'll need to get a new syringe and re-alcohol wipe the injection cap. So we're going to apply gentle pressure, and if there's no pressure, we can infuse. If there is pressure, you need to call the home health agency for further instructions. So with no resistance, we're going to apply some of that, and once we know that we've got it's going in easily, then we're going to pulse in the rest of it. Okay. If you at any time lay this down on the patient or on a surface, you need to re-alcohol wipe. So now you're ready to remove the cap from the tubing, line these two up, push and twist. Okay, turn the pump on. Check your battery to make sure you have a full battery. We're going to say yes to program, yes to repeat RX, and we're ready to push the run button, which is in the upper corner, to start. When the pump starts, you can hear it. You can also see these information that's on the pump, like how long is remaining of your infusion and some other information to pop up big. That will tell you that it is running. Also, the green button next to run should be flashing. If the yellow button next to standby or the red button next to alarm are flashing, or the pump is making a beeping noise, it is not running. Please call the pharmacy for further instructions. Okay, we're ready to put your TPN in the backpack. Open up your bag. Open up the large Velcros. There is a clip that needs to feed through the top of the bag. There's a little hole for it right there. It will fit. It's a little tight. And then you want to clip the two ends together and pull the end tight. Pull your large Velcro back, and there's some extra little Velcros. And then close it up tight. There are 2 pockets down below for the pump, but in order not to crowd the bag, I prefer to put the pump over here. Make sure that your pump is running when you put it in. Fold it over. Zip up your zippers. One at the top, one at the bottom. Don't worry about crimping the tubing. There's a special little place for the tubing to come out. Make sure you have all of your tubing so you have plenty of line. And now you're ready to be mobile wherever you're going. Your TPN will run over 12 to 24 hours depending on your prescription. When your TPN bag is finished, your pump will stop. Turn your pump off. You'll need to gather up a few more supplies, some alcohol wipes, a swab cap, another saline syringe, and a Heplock syringe if you've been instructed to finish with Heplock. First, clamp your line. Remove the tubing from the injection cap. Make sure that you leave the injection cap on the IV line. It protects the line from air and from bacteria. Do not remove that. Open an alcohol wipe. Have somebody hold that for you if you need to, or open this before you alcohol wipe. Remove the cap to the saline syringe, and again pull back on the syringe to break the suction and push the little air pocket out the top until there is fluid at the top of the syringe. Providing you haven't touched that, line it up, twist, and push. You'll need to unclamp your line. Since your TPN has been infusing, you shouldn't have any resistance, but push gently at first and then pulse the entire syringe. Disconnect and discard your syringe in your sharps container. If you've been instructed to use heparin, remove that. If you need to re-alcohol, if you've touched the end, remove the cap, remove the air, line it up, twist and push, and slowly push in the heparin, the entire syringe. Discard in the sharps container. The last thing you're going to do to your line is make sure you clamp it. Remove the top of the swab cap. You may need to line it up, and you may need to push, especially in the wintertime. It gets a little hard. It will fit. Push hard and remove the plastic covering. These will protect your line from germs from your skin getting on the end of it and will reduce your chance of infection. Remove the tubing from the pump. Close the arm. And discard the tubing and the bag connected into the trash.